Everyone. We haven't done a lunch and learn in a while because I was out of town. You
So
were out of town.
We're
doing our little European adventures, and Georgia is on one. So if you hear her barking, good luck, everybody.
Yeah, she'll come join us.
I'm sure she'll come join us. But we thought we'd do a really quick lunch and learn because we have a special going on this month, which we coined Easy on the Eyes.
Easy on the Eyes.
Easy on the Eyes.
Yes.
And the reason we named it is we're going to talk about the two technologies, but we're combining something called EZGel, which is uses PRF, and I'll explain that portion. And then EMFace under eyes.
Right under the eyes.
Which Kristi is the master of. And so maybe what we'll quickly do is sort of explain the package. So I had been doing a lot of this as combo treatment along with Kristi and along with Ricky. And so we thought, let's give patients some savings. Yeah. And so you save $1,500 when you do the series of EMFace under eyes. You do the EZGel, which is 2 treatments.
Right.
And then as a bonus, we have been giving out Lumières Riche, which is
a fabulous product.
This is an under eye treatment. Well, actually you can use it all around the eye, but it's a growth factor cream and has several ingredients that help with sort of collagen stimulation, elastin. There's some caffeine in there, so that helps with under eye puffiness. But we thought that's a complete treatment. We always want you doing something at home in conjunction with the treatments we're doing. So why don't you explain EMFace first, and then I can kind of explain the EZGel portion of it.
So EMFace is something that, something original, something that we haven't seen before, and it is actually muscle toning and radio frequency to the skin, so you get a dual benefit. We are targeting the little tiny muscle under the eye here, which is an elevator muscle, and it actually, what EMFace does is it thickens the muscle, strengthens the muscle, and then also with the radio frequency helps to strengthen the tone of the skin above that. So in doing that, we can reduce puffiness, we can actually reduce discoloration in the area, reduce fine lines and wrinkles, and what else? I think that's...
Yeah,
we were
the
hollowing. Also.
We were a site.
Yeah.
So we were actually one of the 3 sites for the trial that we will be, I'm sure, presenting at meetings going forward. So it was 2 dermatologists, including myself here in California, and a plastic surgeon on the East Coast. And at a month, we found that there was a 61-62% reduction in under eye circles. There was a 1.4 milliliter reduction in under eye puffiness. So that's basically like a syringe and a half of material, if you think about that. And about a 28% improvement in the crow's feet, because it's a little sort of almost Y-shaped applicator.
Just like this little guy here.
The whole area treats with radio frequency, so that helps with collagen stimulation, elastin stimulation. That's why we see textural improvements with the crow's feet. But what the under eye portion of the patch does is it tones the orbicularis oculi muscle. So we've got an O-shaped muscle. It's a sphincteric muscle, means it closes something, it closes the eyes. And the under eye area is like the corset that holds in the fat pad that sits under here, called our infraorbital fat pad. And it's also what helps drain lymphatics, it helps with circulation, and it also gives it gives tissue thickness to the area. So it also just, it's like the corset that holds in all this area. So when we tone that, it helps with all those things, which is why I think we saw such dramatic improvement in volume reduction with people with under eye bags, and improvement in some of the under eye. It's non-invasive. The contraindication is we can't use it if you've got a big metal implant somewhere
close to the ear,
because we have to ground some of the radio frequency with it. But it's very helpful. It does not hurt. I've gone through a series of the 4 treatments, which we did in the trials. We're recommending 4 to 6, depending on your age and the severity of the under eye bags. But it does not hurt.
No, it's easy.
What do patients say it feels like?
It feels almost just like a little buzzing to the area, so almost like a little vibration. You feel maybe a little contraction, so it might make you feel like you need to close your eyes, but I just tell patients to keep their eyes closed during the treatment. Very comfortable, warm, almost kind of soothing. Yeah. And it's a series of, like Dr. Palm said, 4 to 6, where you come in once or twice a week, and 20-minute treatment, very easy, no downtime, so you're a little tiny bit pink afterwards for maybe 20 minutes. Yeah. And we'll put a little tinted sunscreen on you to go, and you can get right back to whatever you need to do that day.
Yeah, so I think fairly easy. Like I explain it to patients, it feels like a warm pad in the area because of the gentle radio frequency, which does not eliminate good fat. It just is helping build the dermis, the collagen and elastin, really important. And then I think it almost feels like Velcro, like somebody's got a piece of Velcro and they're removing it from your under eye, but it doesn't hurt. It's just a funny sensation. Yeah. So I think it's kind of relaxing.
I do too. I do too.
A relaxing part of my day when I do get a treat, and I need to do a little treatment with it. So what I love about it is it's truly regenerative. We've never had anything short of surgery to regenerate the muscle. We relax that muscle when it's hypertonic, so overacting, when patients get something called a jelly roll, but we don't want to over relax that area. If you over treat with a toxin sort of inferior to what we call the lateral canthus, so it's sort of where our under eyelid and upper eyelid sort of mash together, you can relax that too much that you can cause herniation. So people will sometimes get shelving, they'll sometimes get fullness in that area, or they get fluid accumulation if we're doing too much toxin. So this is a way of strengthening that area. So we thicken the tissues, and we've never had a way of building back some of the muscle, which there's a slow decline in our muscle mass, including our facial muscles over time. So regeneration in terms of muscle and regeneration in terms of skin. And I'd like to pair that with something called EZGel, which is something that Stephanie and myself do here in the office. And this is where we take a sample of blood, and it's somewhat similar to PRP, which a lot of people have heard of, which is platelet-rich plasma. And that contains growth factors that can be deployed into the skin to help with skin quality, and we use it in hair loss. So we switched here at the clinic about 3 years ago to PRF. And PRF, how it differs is we take that same sample of blood, but we spin it down slower, and we don't add anything. So in the processing of PRP, we add something to help with the fraction of the PRP, that golden portion. With this, we just use gravitational forces, slower centrifuging, longer period of time to process. And through gravitational pull, we get the PRP portion of it, but we also get the fibrin matrix. And that contains growth factors as well as pluripotent stem cells, which all of these are yummy, sort of like soup that we then re-inject into areas to help with collagen stimulation, elastin stimulation, and overall health of the tissues. And the nice thing with PRF is that when we deposit this, it is active, so the growth factors and these pluripotent stem cells, for up to a week after implantation. So we're doing this twice. We usually spread it out 4 to 6 weeks apart. And then we do something special. I'm not going to give away our special sauce, but we do something different than what is in sort of the manufacturer's recommendations to help with comfort. So I tell patients, I had it twice just the regular way, and it's fine. It feels a little weird. It's a little bit uncomfortable, but we do some special comfort measures here to make it very easy. We use a cannula to administer it, so the chance of bruise is quite small. I do counsel patients, so when we do this, it's the only time I actually sometimes will slightly overfill an area, because I want as much of our fertilizer there, of these good growth factors and the pluripotent stem cells that are in this EZGel magic to deposit. So I do tell patients, like the first time you're doing this, please don't be going and getting prom photos, or getting a big speech, or doing something obviously super important, social or professional wise. We want to make sure that, I'm a swelling Sally and I bruise just looking at a needle or a cannula. So I'm always a good test subject, because I'm like the extreme manifestation of things. And I can be a little bit swollen for 4 to 7 days. So I tell patients, usually 1 to 3, but we want to be on the safe side. But I really, really like this product, and I think we're at a time where we have always been geared like this as a practice. I mean, you've done things that enhance regeneration with muscle toning on the body. We have been doing things like collagen stimulators and PRF for a long time. I've been injecting things like Sculptra and Radiesse for now almost 2 decades, but we're looking towards things that restore your body's natural architecture. So I love this combo, because we're doing something that's your own fertilizer to build back collagen, something to build back muscle and collagen, and then you're doing something at home that's growth factor based to help with that process. So I think it's a really great package. We wanted to do something special for summertime. This is certainly something you can do with minimal to no downtime in terms of the EMFace. I think with the injection, you just want to time things appropriately a little bit. But wanted to bring it to you. We
Yes.
love doing it. I've gone through the series, so I'm happy to talk to you about it.
I would love to
You've
see
had
you.
EMFace, so you
Yes.
can talk from firsthand experience.
Absolutely.
And we're very fortunate. We're a site in California that on average is doing about 3 times more treatments with EMFace than the typical clinic. So you really are in, I think, expert hands, and we really just want to choose things that are sort of evidence-based and we're seeing really nice outcomes from. So I think this appeals, especially at a time where patients are very curious about regenerative longevity. You know, I think this falls into that vein. So want to thank you guys for tuning in.
Thank you.
If you want to get a hold of us, we're on
Yes.
lunch break, but you can certainly look at our website, artofskinmd.com. We can also look at the Art of Skin Body website. Say you're always doing a fabulous job, Kristi, along with Ricky, about putting
Instagram, yeah.
Yep,
On
the Instagram
Instagram.
sort of photos, so you can actually see progress from things. And then if you want to give us a call, it's 858-792-7546. We'll be open for afternoon clinic, but we're here Monday through Friday.
Perfect.
All right. Thank you
Thank
guys
you
for
so
tuning
much.
in. I'm going to turn it off, okay? Have a great weekend.